or is she good to go?
No, she's good to go. I already talked to her about it.
Here he comes.
If you had waited, he wouldn't have come.
Ah. Good morning, everybody. And welcome, Alex. Today is Wednesday, April 16th, and I'd like to call to order the Public Health Committee. Please call the roll.
Arroyo,
We're here.
Juby. We here. Genesis.
Hennessy's here online.
It's online. Carver,
Carver's here remotely.
Young,
Here remote.
Sanchez,
Sanchez present.
We can see them, but we can't hear them.
Yep. Strathman.
Strathman here.
And then Sarah, you need to call me too,
Okay.
Rachel. Oh, be quiet.
So, again, was that for me? Oh,
See?
well, I'd like to ask for remote attendance we have several this morning, for Mr. Tarver, who I see is online, Mr. Young, who I also see is online, Jarrett Sanchez, is he online? Yes, he is.
Yes, ma'am.
And for Ted Penesis. Any objections? Okay, great.
Madam
Okay.
Chair. Madam Chair,
Pardon me?
can you call Bill Bill Roth into the meeting to make up our quorum?
Thank you.
Rachel,
Call.
Roth.
Roth here. Thank you.
Now we're legal. Okay, thank you for that. Thank you.
That's why the phone said something went wrong.
And I would like to ask for unanimous consent for the approval of minutes from March 19th, 2026. Anybody?
I'll do it. Roth would request we make a unanimous consent to accept the minutes.
Objections? Okay, so be it. And now we'll start. Oh, before we start, I would just want to say today is National Librarian Day. How about it? And it's also National Orchid Day. So if you know a librarian, buy her an orchid today, or him. That was pretty sexist, sorry.
Yeah.
Those are orchids next.
What was that?
The art orchids.
Yeah. Okay, and now we have public speaking, and I have Miss Jean Meyer. Good morning.
Good morning.
We'll have 3 minutes.
I would like half an hour.
Didn't we all?
I'm going to start. This is Jean Meyer. I am a registered nurse, master's prepared. I'm going to start with my ending because I haven't had a chance to see if it's too long. But low iodine and high fluoride lead to hypothyroidism, too low a thyroid. And that causes, the low iodine is one of the leading causes of mental retardation in the world. But hypothyroidism leads to both obesity and depression and to the whole range of mental diseases out there. And obesity and these mental conditions, especially depression, are both public health emergencies. So what I want to say is, I don't like the Band-Aid approach. If you have a nail sticking out of the end of your computer desk and you're getting a laceration on your abdomen, don't just put a Band-Aid over it. Take the nail out. Okay, so the state mineral fluorite in the state of Illinois, they declared it the state mineral in 1965, is used to make steel, enamel, aluminum, etc. Illinois is the leading producer of fluorite in the US. And when those manufacturing processes are done, that fluoride leaves as a waste product with a skull and crossbones. Now we know you can die from water intoxication, so yes. But I was just reading a Crest toothpaste yesterday, and it said, keep away from children. Recommended only to have a pea-sized drop on the toothbrush, and the child should spit it out. So fluoride is in the public health news now, since RFK Jr. will tell the CDC to stop recommending fluoride. In the 1970s, I actually wrote a paper on why fluoride really is not helpful to the teeth and why it's toxic. My mom was extremely anti-fluoride. And to this day, I had one cavity in my baby tooth. And at 65, I've had 2 cavities in my adult teeth. So protecting myself from fluoride, it hasn't seemed to hurt too much. Robert Redfield, President Trump's last CDC director, said recently, instead of focusing on the fluoride, we should focus on obesity. And I don't remember what else he said, but that's the Band-Aid approach, because in fact, if we are replacing fluoride in our cells with bromine, we're replacing iodine at our cells with both fluoride and bromine, we are causing hypothyroidism, which leads to those obesity and mental disease. So no more Band-Aid approach. Let's not poison ourselves. Thank you.
Thank you. Okay, that concludes our public speaking today. Okay, the reports are included in your packet. Do we have any questions, concerns? Okay. Moving right along. See if there's anybody online. Nope. Okay. Good morning, Mr. Youngstad.
Good morning, everyone. All my reports are on file. Just letting everybody know we are in puppy and kitten season. We just had 2 moms brought in as strays, both gave birth. We're at 13 kittens between the 2 of them. 2 litters of 4 puppies have both been coming in, so we're starting to hit our fun season. But that's good news.
Where are the pictures?
I'm sorry. Ours.
Okay.
One of the moms is asking for a paternity test. She's a young kitten that's not really sure that she's the mom. We're very excited. A week from this Saturday is our first vaccine clinic. Thank you to everybody who's helped get flyers out. It's Saturday, April 26th from 10 a.m. to 1 p.m. We're very excited. Flyers are here at the Government Center. They're available on our website, and we're putting them out to all the libraries now. We're also starting our interviews for our new part-time veterinarian. That will be our first interviews today at 1 o'clock. We're very excited about that. And that's all we have going on at the moment. If anybody needs anything or has any questions, please let me know.
Any questions? Okay. I think I'm going to try to come to the clinic on Saturday, the 28th.
No, please do.
That'd be fun. I haven't been able to be there yet, so I'm gonna.
They're a little busy, but they are a lot of fun, and
like to see.
it's very rewarding for the staff and myself to give back to the community, because these are the people that need it. Wait times can be up to 2 hours. I always warn people, everybody wants to take advantage of this deal. As long as you're in line before 1 p.m., we will not kick you out. And there are days we've had to go till 3:30 still vaccinating, because as long as they were in line, we made sure they got taken care of.
Popular program, so. Okay,
Thank you.
thank you. Any questions? Okay. And moving right along to Public Health, Executive Director Michael Isaacson. Good morning.
Good morning, everyone. I'll keep my comments pretty brief today because we have a couple of great presentations we'll be sharing with you. But frequently we talk about how working at the health department, one of the real joys for me is being able to work with just such fantastic people. We talked last month how we were voted one of the best workplaces in Kane County for healthcare facilities. But today we really wanted to highlight somebody who has done tremendous work to keep residents of Kane County healthy for a long time. We have a lot of old buildings in Kane County, and we have a lot of lead paint, and there's a lot of different products that come in that have lead in them. And our lead program, we'll talk about in more detail at a future meeting, but it's a partnership with our clinical staff and our environmental staff when we follow up on cases where children may be identified who have elevated lead in their blood. But today I'm really excited and want to just really pay tribute to somebody who has served Kane County for over 30 years now, and she's retiring in a couple of weeks. But I want to introduce Olga Del Toro, and I'll ask Olga to come up to the podium here. But I feel very fortunate that Olga has been a good friend, and I've had the opportunity to work very closely with her on a lot of projects over time. But she works with Director Onwuda, and in the audience, we also have our Assistant Director of Environmental Health, Julie Weigel, and one of our environmental health supervisors, Kristen Johnson. And this group already works. Yeah, come on up with Olga. But Olga goes out and works with families and really talks through what potential lead exposures there could be in the home. And sometimes these aren't easy conversations. Sometimes there's cultural attachments to things, maybe cooking vessels that people are using that may actually be dangerous to their children's health. But we want to just acknowledge Olga and wish her the best in retirement and thank her for 30 years. Over the next couple of weeks, we'll be highlighting her a couple more times. But just really wanted to make sure that you, as our elected officials, get to put a face on some of the great work that people do. So I will invite.
And I have for you, Olga, this little bouquet of flowers with a little birdhouse on it, because now we think you may have time to watch the birds.
No birds.
There you go.
Thank you very much.
You're welcome.
Thank you. Okay.
Hi, everybody. My name is Olga Del Toro. I've been working for the health department for 30 years. And I can tell you that I had so much fun. I did a lot of programs. My main program was the lead program, but we did tobacco, we did osteoporosis, we did a lot of health fairs, presentation. I had so much fun. And I think that's the key to being a job for a long time, is having fun and have a great group of coworkers that I can tell you that they're the best. Thank you.
Thank you. 30 years.
So yeah, as you can see, and Olga's just such a positive presence. So we're gonna miss her a lot, but wish her the best in retirement here in a couple of weeks. So thank you.
Congratulations. Okay.
Now-
Next for
n-
you.
Now we will transition and we're going to give a highlight on a new campaign that we're doing to raise awareness around 988. So I want to invite Tina Coral to the podium, and Tina is our health promotions manager. So I think you've had the opportunity to meet her in the past, but she is really responsible for our social media and our website. And before she moved into this position, we were in serious need of improvement, and she's just continues to exceed all expectations and makes all of our outward communications much, much better. She works closely with Julie Mann here at the county board office, but really works with all of our programs to help us better communicate. So excited to have Tina here today to tell us a little bit about 988.
Thanks, Michael. Thank you for having me. Yes, I'll go into the 988 campaign, but first I'd like to give you some basics about the 988 Suicide and Lifeline awareness. Okay, so the 988 Suicide and Crisis Lifeline is a free confidential support to people in distress that's available any time of day or night. So we previously had a number that we could call 1-800-273-TALK. And in July of 2022, they changed that to 988 because obviously much easier to remember. So 988 connects callers with trained crisis counselors to support individuals experiencing mental health crises, suicidal thoughts, or emotional distress. So you should call 988 if you or someone you know is experiencing overwhelm, anxious, or in distress, suicidal thoughts or self-harm. If you're struggling with substance use or addiction, concerned about someone else's mental health. So we have folks that call 988 that may be witnessing a mental health crisis in someone they love and just aren't sure what to do. If you're in need of immediate emotional support, and 988 is not a substitute for 911. So you can access 988 and connect with a trained counselor by calling 988, texting 988, or visiting 988lifeline.org to chat online. So anyone in distress or seeking help for a loved one can use 988. There's specialized support for veterans and their families. There are Spanish-speaking counselors available and interpretation for over 240 different languages. The difference between 988 and 911 is that you would call 988 if you're needing mental health support, if you're feeling suicidal or overwhelmed or need emotional support for yourself or someone else. 911, of course, is used for medical emergencies, injuries, or crime, immediate danger to yourself or others, or if you need police, fire, or EMS. So when you call 988 in Kane County, you'll be connected to the incredible social service organizations that we have here. Immediately when you're called, you're connected to somebody from Suicide Prevention Services of America in Batavia. Those folks will listen and provide support, assess your situation and needs, give you some coping strategies and crisis intervention, and then connect you to local mental health services if needed. So when in-person support is needed, a mobile crisis response team might be dispatched by SPS. And in Kane County, that's provided by Association for Individual Development in Aurora, Ecker Center for Behavioral Health in Elgin, and Family Service Associates of Greater Elgin. So a little bit about how 988 is used in Kane County specifically. Last year, we had 1,670 calls, and most of those calls were people calling for themselves, a little over 1,400. 123 people were calling for a loved one. We had 6 calls from veterans. That mobile crisis response team that I mentioned earlier was called 17 times. Emergency services were called 27 times. And 285 of those calls were folks that were currently having thoughts of suicide. And you'll see from the ages served that, it really runs the gamut, but the most calls came from ages 25 to 34, and most calls were from male, but you can see the gender breakdown there as well. So a little bit about this campaign and the needs assessment and kind of the why about why we're doing this. Our 2024 community health assessment identified mental health as a focus area. The Kane County Board, thank you very much, approved almost 10 million in ARPA funds for mental health support in Kane County, and we are using those ARPA funds for this campaign. Another survey that we did over the winter that informed our behavioral health communications campaign identified the need for awareness of mental health issues, resources, and stigma reduction. And then a survey that we did specifically to measure knowledge and attitude about the 988 Lifeline further identified the need for public awareness. So we had 235 people respond to that, and 71% were unaware of the Lifeline. So most people in Kane County did not know what the Lifeline provided, that we even have it, and that lack of awareness prevented them from using it. So the campaign objectives are to raise awareness about 988 via printed materials, and then to encourage the use of 988 and lower stigma via social media. The campaign will run from May, Mental Health Awareness Month, through September, which is Suicide Awareness Month, so basically all summer. The campaign consists of printed materials, including a window cling, a removable bumper sticker, so you can spread the word about 988 while you're driving around the county without ruining your paint job, and then yard signs. And all of this comes in both English and Spanish. So we're very proud to have 54, I think we're at 55 now, campaign partners throughout the county. So as you can see here, these folks range from school districts, our university and colleges, police departments, fire departments, behavioral health organizations, food pantries, libraries. We were just super excited at the response to this campaign and all the support that we're getting from organizations throughout the county. Those organizations are helping us either distribute over 3,000 pieces of material or put them on their facility locations. And then we have an additional 1,600 pieces available at a drive-through event, which I'll talk about next, at any of these organizations listed here, and then at community events throughout the summer while supplies last. We invite you to attend our Safe Kane County drive-through pickup, which will be happening next Friday, April 25th from 11 to 1. You'll be able to pick up these 988 Lifeline yard signs, window clings, the stickers, but you can also get gun trigger locks, the biometric gun safes, and the lock zone. And that'll be a drive-through event, so you can get these things without leaving your car at the Kane County Circuit Clerk parking lot. So the other component to the campaign is a social media piece. And so we're looking to raise awareness, reduce stigma, and encourage people in crisis to seek help. So we're asking folks if they feel comfortable to post a photo of themselves with the printed material. This could be your coworkers, people in school classes, just you and your family in front of your sign. Post that on social media, tag the Kane County Health Department, and use hashtag 988 Kane County so we can see it and share it as well. And then we also have a toolkit with social media images and messages on our website. So we would love your help. I did bring the materials here today and would love it if you would take some and put them in highly trafficked locations that you may have access to, and help us spread the word about this amazing resource that we have here. So thank you, and happy to answer any questions.
Do we have any questions for Tina? Yes, Ms. Juby?
Thank you. That was excellent. I'm so glad 988 is finally up and running. I just have a question that actually concerns my district. Will you be at Swedish Days in June and some of the other events there? You know, our car shows on Thursday night, our art show in July, things that bring a lot of people, not always Kane County, but will you have a presence at those events?
Yeah, you know, last year, I think we were at 73 different events throughout the county. So we will be all over just as long as we do have materials to hand out. Thanks.
Yes, Mr. Greip?
Oh, thank you, Madam Chair. This is news to me, so I guess I'm in the 72% that hadn't heard of
Could
this.
you get a little closer to your microphone, please?
I think I'm in the 72% that didn't know about this because I'm just hearing about it today. So shame on me. But I noticed that there weren't, I didn't think I saw any service clubs in the list. You had a great list of places you're going, but I'd be glad to help get them to the St. Charles service clubs, Rotary, Kiwanis, so forth. But I think they're great. And I think Mavis is connected with service club. At any rate, the whole thing about a service club is you hand this stuff to them and now they're going out and doing it instead of depositing them someplace and having people come by. So that's great too, but I'd be glad to help do that in this area.
Great. I'd be happy to connect on that.
Okay, thank you.
Do we have any other questions? I have a question for you, Tina.
Madam Chair, I have my hand up as well.
How is it just, what's the definition of emotional support?
The counselors are trained in that, and I'm probably not the best person to speak to that, but they do have folks that are trained to handle that type of thing. I think, you know, when you're determining if you need to call for yourself, it's anything that you may feel is out of control for yourself or another. I think they can provide support for that.
So it doesn't have to be as critical as suicidal thought.
Absolutely no.
Okay, any other questions? Well, thank you for an excellent program. And did you bring bumper stickers today?
I did, yes.
All right. I would like some bumper stickers and a sign. So anybody get them from Tina before we leave. That'll be great.
Thank you.
Get that out. Thank you.
Thank you, Tina. And this is exciting. And to Mr. Gripe's point, 988 is relatively new. And when I've talked to people about the advent of 911, people talk about how that took years and years and years for it to become like it is now, where we just know you call 911. So it's one, it shows how important it is to get the word out so people can start to know, but we're also continuing to develop how we respond as 988. So we have our mobile crisis organizations, which Tina mentioned, but also there's some cases where you need to co-deploy. And so we maybe need mental health counselors and the police So we're still as a community working through that with our EMS systems and law enforcement. But this is just a really tremendous resource nationally that's going in place that's filling a really important need, I think. So, but thank you, Tina, for the great work on that.
That was really impressive. And so timely too, right? I mean, although we could have used it years ago, so people now would know about it, but thank God it's here now. So thank you. Okay, so moving right along.
Moving right along, we have a resolution that we're bringing forward, authorizing a budget adjustment so that we can purchase lead poisoning. Well, I'll just read the resolution is authorizing budget adjustment for the lead poisoning prevention and response grant. But what this is changing over to an equipment line item so that we can order a new machine that can detect lead on surfaces.
Okay, I'd like a motion and a second and then to discuss this.
Doobie moves.
We move.
Carver seconds.
Roro seconds, thank you. So tell us a little bit about this.
Great. So we highlighted Ms. Del Toro just a few minutes ago with the great work she does. But when we do get elevated lead results from a young person in Kane County, as I mentioned, and we'll dig into the numbers, I think, when we have more time at a future meeting, because this is a really important, pretty exciting program. But this is a partnership that includes Mrs. Barrett and Mrs. Onwuda's teams to go out and respond both for clinical and environmental. On the environmental side, what we're doing is this is another case where in public health, we're playing detective to say, where is this child being exposed? Where is there lead in their environment that may be poisoning them? And this machine that we're putting forward, this SciAps X550 lead paint analyzer, and I can send around, there's a nice YouTube video that the company has that shows it in operation and is pretty cool. But this is something that our team can use to take out to someone's home, and you can actually put it on samples and identify if there is lead present. I don't know if Director Onwuda, if there's anything else critical that I'm missing.
Yeah, thank you. So prior to now, IDPH has lent us their equipment to use, and it's radioactive, slightly radioactive. This one is non-radioactive.
Oh, nice.
So we've been waiting for IDPH to make a move on, this equipment, and they haven't done that. We've been waiting for 2 years now. And so we had a little extra money in the grant that we're able to use to buy this equipment. So the time is now, to make that move, especially with the baseline level dropping from 5 to 3. There are a lot more children that will be in that range that of lead in their blood. So we're having to do more testing, more homes, so this is a critical need for that machine right now.
Well, it sounds so much better for the person who's going out with it all the time, that it's not have that little radioactive component to it. So that's fabulous for the provider that's not going to be exposed to that.
Right.
So, and can you tell us just a little bit so people know what the effects of lead is on children?
So lead actually affects the brain of small children. The lead program in Illinois is for children 6 years and under. So this is the time that the brain is developing. So, them being exposed to lead really affects their learning, brain development. So being able to identify these children quickly and then working with them to remove those places where they're exposed to the lead in the home. Usually it's lead paint. Sometimes it could be some food. Olga always has this lead pots that they use to make food down in Mexico. So educating families, where these sources of lead exposure are and what they can do to mitigate that is actually what the program is about.
So when you buy that pretty plate or that pretty pot that says not for food.
Yes.
this-
Yeah. And toys, children's toys, there's a lot that, lot of lead out there. Yeah.
I lived in an old home and replaced all the paint in it, and I thought I had no lead at all. And then I found out that my old windows, that creates a dust, just opening and closing the old windows that had paint from years, or even the finish that was on the wood. It doesn't have to be paint.
Right.
Now that we know better, we're trying to do better and not put lead in everything, even makeup and all kinds of things like we used to. So it's a really important program. So this is like the 21st century, isn't it? It's very cool. Mr. Roth, you had a question?
Yes. Yeah. Yes, you may.
Okay, excuse me 1 second, Mr. Roth.
Let me jump in here. All the folks that are online and not in the room, could one of you go ahead and turn your mic on and just tell us, say something so we can make sure we're hearing you?
Can you hear me now?
David Young. I
That-
can hear you
All
loud and
right, it
clear.
appears we might have a global issue here in the room with everybody's audio online. Let me see if I can work on it. Go ahead and continue. Anybody online that has a comment to make, for now, go ahead and use the chat feature and we'll read your comment into the record.
Skynet is
Okay, thank you. Okay, thank you for waiting. Mr. Roth?
You said you had a flyer on the equipment. Just how small is it? Is it very portable?
It's portable.
Okay. And then do you have to, it will measure the surface without disrupting the surface as versus having to take a paint chip and,
Right.
okay. And then is there a life where, some equipment expires? They built that in, unfortunately, and some, there's not with this one, is it?
I don't recall. It's pretty new because for
Right.
years we've used the XRF
The
machine.
other one, which
Yeah.
was radioactive. Yeah.
Right. So,
Okay. Just curious,
yeah.
So yeah, Michael, if you could send the flyer to I would say everyone on the board,
Yeah, definitely.
please. Thank you.
My first 2 years at the health department, I sat next to that machine. So I don't know if that was intentional or not, but
So that's why you're always glowing?
there's
Oh.
just, yeah, there was a warning on it, but it,
It's a
yeah.
glow around you.
Ms. Bates, you had a
Yeah, I
question?
have a question. As I've been out knocking on doors thousands of times, I see paint that's etched in squares. And I believe that means it's lead. Do you know that? Do you know
Paint?
about that?
Hmm.
Paint that is cracking, but in rectangle, okay, never mind. I'm asking at the wrong meeting, I guess.
Oh, that would be
But
interesting.
I
to-
believe that's true. And I have some of that in my own house too, which is 127 years old. So would be a warning to people that if your paint is cracking and peeling, but in straight, I'll Google it right now. Okay, never mind.
And please share.
Okay.
Yeah. Mm-hmm.
What was that?
Mm.
Yeah. Yes, Mr. Wright.
But the
Thank you.
dust comes off.
Thank you, Madam Chair. So just curious, Michael, or either one of you could address, so you're testing people, kids, I guess. How do they come in to be tested? Is that?
Sure, I'll defer to Director Barrett, on clinical side of it.
Yeah, so with our lead program, and like Michael said, we'll do a much more in-depth review of this, but just very briefly, all children under age 6, if they live in certain zip codes in Illinois, or if they are on Medicaid, there will be all medical providers are required to do a lead screening on all children. And so if they answer yes to some of these questions on this lead screening, and the zip codes are in there, if they're on Medicaid, they live in a house that was built before 1978, there's all these questions. Any question on there that comes up as a yes, they will get a finger stick at the doctor's office and they do a little finger stick on it, put it in the tube or the slide, send it to the state lab for it to be tested. If that test comes back at 3.5 or higher, we are notified at the health department, and the nurses take on that case, and they work with both the provider and with the family to make sure they go in and get a venous blood draw, because the capillary can be false positives. So if their hand's not real clean or something like that with it. So they'll have to come in and get a blood draw to have that done. If that test is now at 3.5 or higher, we work with the lead investigator, and the two of them go out to the house together. The investigator goes through the testing pieces to try to identify, as Michael said, and the investigative part of that is, where is that source of lead? Is it in toys? Is it in food? Is it in the soil? Is it in the paint? Is it in the water? Whatever it could be coming in, that we have to go and find that source. And then the nurse works with the family and the providers for follow-up testing, for mitigation treatments. So once we know where that location is at, the nurse will work with the family to mitigate. So you talked about dust from windows going up and down. They want to make sure they're damp wiping down those windows on a regular basis, so that that dust is not airborne and they're not getting it. Or if the child's, lots of toddlers, they pick up things and they eat things. So washing those hands before they go to eat anytime, and keeping the floors clean, those type of things, with damp mopping with it. So whatever it could be, that'll be what the nurse will then identify what that specific need is for, depending on where the soil, where the lead is located. And then they'll be following up with them, and it can take quite some time to do the regular checks to make sure those blood tests are now dropping. So they have to go in for the venous, the lab draw, to get the blood test on a regular interval until we can see that it's dropping and below 3.5. So they follow those cases all the way on through.
So that's kind of what I was hoping to hear. But my question is, I mean, it's common knowledge that most of the pipes in Elgin, St. Charles, pretty much everywhere, they're lead. So if you detect it and it's coming from the water and it's an older house, there's gonna be lead paint in that house. Other than having them repaint every house that those kids are in and rip out all the pipes, which can't be done. How do you deal with this? Because it's a citywide problem.
So good question. With lead in the pipes, they will want to teach them to make sure they run the water for a period of time before they draw any water off to drink, brush their teeth, do any cooking with it. So they're not ingesting it. So it has to run for a period of time with it. And they usually work with cold water versus hot water.
How
to
long?
Let that run in.
Filters.
How long? Like
I
a minute?
believe it's 2 minutes, but I would have to clarify with it. I mean, we've got the instructions down if that's where the lead is
A lot
coming
of
from.
wasted water. But
Until they get those lead pipes in many of our cities that have those lead pipes, and have got some really strong programs that are working, but it will take time. There's a lot to be changed on out. Elgin's done a fantastic job
St.
up there
Charles
for
has the
it.
same problem too.
Yeah, many of our older.
This is for children under six and under. So it's not like for everybody. This is specifically for children 6 and under. Elgin has a fantastic program, just like Ms. Barrett said. They have some of them, they have filters that they have offered to the families and all kinds of mitigation efforts. So those are ongoing. What we're doing here is for, children with lead in the homes. So that's a different program than, what the cities are working on with their lead programs.
So we want to, there's no good exposure to lead, right?
Right.
So
Zero.
right. So when we find in most of these cases, there's other sources of lead that are in the home that our program's focused on. Director Onwuda did reference the drop from 5 to 3.5. So that is the amount of lead that's found in the blood, which means we're casting a wider net so that we're going to be able to protect many more children by identifying them sooner. And identifying more children. It also means it's much more work for our team to do. So we are getting some additional money from the state to help this, but it's really dramatically increasing the number of families that we need to serve, which is a good thing in this case. Removing lead from service lines is a similar issue in that we're trying to limit exposure to lead, but in most cases, that's not what we're finding as the primary source. These are other things that are elevating it. But as we know, working with the municipalities, the price tag on changing out all of our service lines is staggering. So that's something I think that is a very positive thing for us to be moving forward and doing. But as we know, it takes time. Elgin's one of the leaders, I think, in really investing and doing that. But as I heard each person go, this is a problem in my town, in my town, in my town, like in all of our towns, we have lead service. So,
Again, now that we know better, we're trying to do better.
Exactly.
With the lead. Leslie, Juby, you
So
have
I
a
was just
question?
going to add that the EPA said you should run your water for 30 to 45 seconds unless you have really old corroded pipes, and then it could take up to a minute. The city of Geneva told me to run it until it was hot or run it until it was cold, which is about half a minute. So that's what the EPA said. I didn't make it up.
Thank you.
I have a paint report. Cracking lead paint often exhibits an alligatoring pattern where the cracks form a rectangular or square shape resembling the scales of an alligator. This is a common sign of lead paint that is deteriorating.
Oh, good to know.
You see paint that's
Yes, Ms. Peterson.
like that.
I also want to add from a neurodevelopmental perspective, and I'm sure Laura's group will talk more about this, but just as mitigation strategy, these kiddos are also automatically eligible for the state early intervention program. So again, lead causes developmental delays in children. And so they are automatically eligible. And that's part of what our nurses do, is also refer them to those services to ensure that their development is progressing and that they get any therapies needed to help that development continue on throughout the lead mitigation process.
I have heard that lead exposure can increase aggression. Is that part of it, or is that an urban myth?
I am not sure about that. I only know the developmental delay piece, having worked in early intervention for so long. And so again, they're auto eligible. They don't have to present with a delay in that moment. So just make sure too, if you have families in this situation, that they know that they're eligible for early intervention services.
Thank you. Ms. Juby?
There was a Mother Jones investigative report several years ago about lead in gas and how as it breaks down under the soil and comes out, they started noticing cohort groups that were aggressive, that were not doing well in school, spikes in their jail populations. And so anyone who's interested in reading it, it is fascinating and very, very scary. It's the Mother Jones Dangers of Lead. I don't remember what the actual title is, but it is very, very interesting. And it shows the cyclical breakdown of lead from, like farms that used to store their tanks underneath, and how they'll go and then they'll have whole spikes of 10 years of horrible behaviors, or in cities and things like that, and how it affects core groups of people because a lot of times the soil was not remediated in some of the higher risk areas. And so it's very fascinating.
Lots of really good information here, which is always part of public health, is right, educating the people of what the problems are, what we can do, how we can help. So thank you
And
for a lot of really.
if
good
I can just add on to what you said, Madam Chair, that when we know better, we do better. As we get better at linking some of these environmental exposures, and we've certainly known about lead for a long time, but we talk about microplastics, we talk about other forever chemicals that are out there. On one hand, it's easy to just throw your hands up in the air and be fatalistic that there's so much stuff out there that can be harmful to our health. But in most cases, we do have ways that we can at least stop the damage that's being done and start to remediate what's happening in the community. So I think this is just really important, is for all of these environmental exposures that we're investing in programs that are helping to keep people healthy.
Well, and I love it that Laura said that, even wiping down things, wiping down with a wet cloth or wiping up a floor can help. I mean, those things don't cost us. So education. So thank you for a great thing. So are we ready to take a vote on this? Entering in the 21st century for the Public Health Department. Please call the roll.
Arroyo, Juby,
Juby, I.
Genesis,
Genesis, yes.
We could hear him, great.
Tarver,
Carver, yes.
Young,
Yes.
Sanchez. Okay, Strathman.
Strathman, yes.
And
Okay, it passes.
Real quick, Madam Chair,
Rob,
can you hear
yes.
us? It worked?
Sorry.
yes, we can now. Mr.
Thank you very much, everybody.
Yes, good. Okay. Okay. And next,
Next, we have a resolution authorizing the adoption of the 2024-2027 Community Health Improvement Plan. This is a planning process, and we'll have a presentation by Director Alleman here. But this is something that getting board approval is a requirement for us to be a certified health department in the state of Illinois, and it's a requirement for us to be nationally accredited. But also it's good for our policymakers to see what it is that our community has identified as the top priorities. So with that, I don't know if we need to get it on the floor before we do the presentation, or do you want the presentation
I think
first?
it'd be helpful to do it beforehand so that
Okay.
people can understand the parameters of this.
The page here?
She's going to do a presentation, I think. Mhm. Good morning.
Morning, everyone. Can you guys hear me if I'm about here? Okay, great. And then did the slides make it in? Perfect. All right. So we've got our community health improvement plan, as Michael introduced. Let me get used to this. Oh, perfect. Okay, great. So this, as Michael was alluding to, this is a requirement for us to be a certified health department in the state of Illinois. That requirement is the Illinois Project for Local Assessment of Needs, or the I-Plan. The I-Plan consists of a couple different aspects to it, one being a community health assessment. So this was the survey that we propagated about 1.5 years ago, I believe, as well as some focus groups, some key partner interviews, things like that, just to kind of assess the health of the county as a whole. And then we go through with our community health improvement plan. So we take a look at all of those data. We meet as a community and we try to decide on what we want to prioritize for the next 3 years. So one quick shout out to the National Association for City and County Health Officials, who came up with the MAP 2.0 framework, or mobilizing action through planning and partnerships. So this is the framework that we use to help guide these decisions that we make. So I've mentioned community partners already a couple times. So this process that we go through, we collect all these data from our residents, from our partners, from people working in the community. And then we got together in May of last year to go through the data and pick our priority areas. So this is a breakdown. We had 50 community partners at this meeting. We had a wide representation, both from local government as well as healthcare providers, community-based organizations, and behavioral health to help support our decision-making in this. So as you can see here, these were the final poll results for the top priority areas for King County for this cycle. So the top 4 that we decided to act on and develop additional activities and objectives for is behavioral health, access to healthcare, housing, and food access. So it's really, we prioritize these as a group, and then the health department came up with some activities and objectives to work through. So that's what I want to spend the next couple of slides going through, just the existing data that we have, and then the overall objectives that we've come up with. So first, our access to care. So the top challenges that came out of this assessment were the shortage of primary and specialty care providers, culturally inclusive providers, the lack of time and conflict with work during clinic open hours. So this would be residents being able to actually access and schedule appointments. And then limited transportation options for some of those rural residents that we have. And there's a couple different measures up there that I won't go through in detail. So our overall goal for this priority area is to improve the equitable access to quality and affordable healthcare services. So we have 2 different objectives. The first is to investigate the hiring of 2 community health workers. So what this would look like is just how these positions would be worked in the health department, how they'd be funded, et cetera, what exactly they would do. So to just kind of have a plan that would say we've assessed whether or not this is something we'd like to pursue. The second objective is to take the results from the community health assessment and kind of create these sub-analyses that would focus on more distinct populations within our county, just to see if there's any difference in access barriers across these different populations that we can focus on a little bit. So next we have behavioral health. So the top challenges that came up when discussing this one were insurance limitations, the stigma around seeking care, wait lists, high costs, and culturally inclusive providers. So people speaking the language that you speak and being able to provide care in that way. So again, we've got a couple measures up here that we're keeping tabs on. The objectives for this one, the overall goal is to improve the behavioral health system in King County. Again, huge shout out to Director Peterson and the work that her team is doing with the ARPA funds as well. So one of our main objectives is to increase the number of qualified healthcare providers per 100,000. We also have the goal to try to increase the behavioral health professionals capacity. So by providing 5 free trainings throughout the cycle to help support the providers that we do have in things like, thank you, evidence-based practices. So things like buprenorphine prescription and all of that stuff. We also have trying to increase the public understanding. Again, we had Tina's presentation this morning about the 988 campaign, and then reducing our behavioral health hospitalization rate through the social equity, harm reduction, and preventive care strategies. So the next one, food access. The top challenges that were identified was difficulty obtaining fruits and vegetables, challenges for seniors and people with disability and those lacking transportation, and then including culturally inclusive food options at pantries, and then concerns about the sustainable funding. So again, we've got a handful of measures up there. The main objectives that we have for this one is to provide funding for some of these local food pantries and food banks to help expand their services to hopefully decrease the food insecurity in our residents. The second one is to kind of support the Hunger Relief Network in their work in whatever ways we can to hopefully help strengthen the relationships to provide this service across the county. Last but not least, we have our housing access priority area. So this top challenges included gaps in emergency shelter capacity, lack of affordable housing units, the need for wraparound services, and then senior adults and individuals with disabilities being disproportionately impacted. So again, we have a couple of different measures up here. The 3 objectives for this one, number 1 is to provide funding through the Safe Spaces Healthy Minds that would support the local shelter system in helping provide increased services to our residents. The next one is supporting the Chicago Metropolitan Agency for Planning, or CMAP. They are conducting a needs assessment in Kane County to kind of just assess the status of what's going on for us. So that we would support that by attending meetings and helping distribute their survey and results. And then finally, we are hoping to include different partners in a revision of our access and functional needs plan. So this is an emergency preparedness plan that specifically looks at people who may have trouble responding in the event of a public health emergency or any emergency. So to engage these partners to have them help us ensure that we're covering the people that they work with. So our next steps, this is our approval for this, so that we would be able to include this in our I-Plan, which is due next year. So after today, we'll be working on implementing these CHIP objectives, moving forward on this, and then submitting our I-Plan next year. And that is my presentation. I'm happy to take any questions.
Any questions? Mr. Ruff?
Very good presentation. When you were talking about housing, have you talked to, there's so many acronyms, but the group out of Batavia that is working in the county with federal funds to do housing?
Yes.
Okay. Because we want to make sure we're getting across the different
Aligned.
stovepipes. Yeah.
For sure.
All right. Thank you.
Yes, Ms. Juby.
I think it's really interesting and somewhat concerning, great presentation, that I was part of one of these groups many years ago, and we had the same things. And I'm glad we can recognize what our barriers are. I wish they weren't the same barriers we had 6 years ago. I'd like us to be able to really move forward. So let us know how we can help with that. So I know that one of the really cool things that came out of COVID, which people are probably looking at me like I'm crazy, was access to telehealth, which meant that people were able to see providers that looked like them and that knew their culture. And that would be really great if we could continue doing that, because that just takes one right off the thing, and it didn't cost us anything. So I don't want people to think that all these things are going to cost us money, because they're not. But they will be a change in attitude and a change in priorities, and that's free, but it's hard. And so let us know how we can help. Thank you.
Thank you.
Right.
Madam Chair.
Ms. Bates?
Everybody else get a chance. Is there a plan or a strategy for increasing the service providers for mental health? Because I don't know how you'll do that.
And that's, Director Peterson is already gearing up for this one. So this is part of one of the objectives with the ARPA funds.
So on one of the slides up there, Liz did go over how we were increasing capacity. And a couple of months back, I did a presentation on the ARPA funds distribution. So again, thank you for those funds. And we did use almost $8 million of those funds to distribute to community organizations to increase their provider count, their expertise, so their evidence-based practices through trainings, as well as some of those kind of root causes of poor mental health, like insecure housing, insecure food insecurity, and things like that. So we've already distributed all those funds, and those will be spent over the next 2 years per each organization's plan. So yes.
Okay.
And I'll present, I'm sure as we're going through this process, I'll be presenting periodically about what the capacity increases have been. And we have already immediately seen an increase in Spanish speaking providers, which addresses that cultural competence piece. And telehealth. We have done a lot with IRIS to intentionally include organizations that do provide telehealth to mitigate some of those transportation issues and cultural competence issues.
Okay, good.
Other questions, Mr. Gregg?
Yes, thank you. I agree with Ms. Juby that excellent presentation. It's interesting. I agree. It's going to be hard work because we're all staring at a budget book that's difficult. So one of my concerns is that we try and do things that don't depend on ARPA funds. If they're there, great, but they're going to be gone. So we need to put in place things that will operate independently, hopefully without additional cost. But I'm just curious because it seems as though from the study that the health department said to itself, a food insecurity. So the health department has to equip people with the ability to get to food. And I don't see it that way. The health department is really good at what it does, but if it expands its mission, we need to provide more doctors. We need to provide food resources. We need to provide housing. We need to provide, it's going to be the biggest department in the county. Nothing necessarily wrong with that, but that means the most expensive department in the county. So going back to what Leslie said, I think it's important that we look at existing people who do the things that this survey has identified and get them to do the work, connect them. I think that's what you guys are really good at, is saying, here's a resource in the county and we're going to connect that with this need. So that would be my hope, because otherwise it could be challenging.
Yes, Michael.
Thank you, Mr. Gripe. And we agree wholeheartedly. And there's always a tension when we do a community health assessment. And this is not the health department's plan. This is the community's plan. And that brings tremendous strength to the plan. But it also means that we're not necessarily funded to do any of these things specifically. So I think you just did an excellent job of summarizing what our role is in this. And as we look and guide the planning process, and again, we have over 2,000 interviews that were conducted with residents. like 40 focus groups that were done, all of the primary and secondary data that we got from other sources. One thing we kept hearing is housing and access, these big upstream issues, access to food. So it's a legitimate conversation for us to have to say, well, okay, well, what possibly can we do about that? Much less in a 3-year plan when housing is something that requires millions of dollars. On the other hand, this is what we're hearing. So as part of our job as conveners and leading the assessment, we're raising this up to say, yes, these are the issues that are impacting the health of our community based on what our residents are telling us, based on an assessment by the professionals from all different fields who come forward. And it gets to exactly what you said. Then how can we look at the resources that are already there? How can we potentially work with other partners to bring in outside resources, whether that's federal funding, private dollars, changing the way we provide services, et cetera. But I 100% agree with you. We're not starting a housing program at the health department. We are looking to say, okay, this is what our community needs. There's already people who work on this all the time, including some county departments who have energy around it. So how can we all work together maybe better to serve these? So, but yeah, thanks for teeing that up. That was perfect.
And Mr. Young, I see you have your hand up.
I do. Thank you.
We need you to speak up, Mr. Young. We can't hear you very well.
Okay. Can you hear me now?
A little better. Yes.
Okay. I'll try to speak loudly. So in food insecurity, that is, I guess that's depending upon what someone thinks food insecurity is. Does that mean that, you know, they can't get what they want, or they can't get what is needed for them to survive? And I think that you start to go down a little bit of a slippery slope when you are looking at food insecurity as a problem in Kane County. The big, well, I guess I have a couple comments, and I have a couple questions. First of all, when you start talking about food, the health department should really be focusing on, if you look talking about food, when are you going to start talking about obesity and the problems that we have from kids all the way up, from kids that are 5 all the way up to people that are 95. And you start talking about food insecurity, you know, it's what I want. I want a Krispy Kreme donut with a Big Mac and some fries. Well, no, you should not have that because obesity is a problem. I'd like to know how many people were surveyed that said that food insecurity is an issue. I mean, we have 500,000 residents in Kane County, and the same with the affordable housing. And I'll wait to hear that response.
Great. Thank you, Commissioner Young. And I don't disagree with anything you said. And as a matter of fact, we have all the data that we can share from the focus groups, and we have a nice large report for anybody who really wants to do a deep dive. And we've got a great data website as well at Kane County Health Atlas, Kane County Atlas.
KaneHealthAtlas.org.
KaneHealthAtlas.org, where you can see the data. And one parallel, though, one thing I would like to point out is frequently there is this interesting inverse relationship with food insecurity. So when somebody doesn't have, they're self-reporting that they don't have access to enough food by the time they get their next paycheck. And it gets into the example, actually, like you just said, where especially for young people, if there's not enough food, they are more likely to be having really nutrient poor foods. So there is an interesting correlation between food insecurity and obesity in young people, which seems like it should be the reverse. But young people who don't have access to enough food can be at increased risk for obesity, meaning they're getting too many calories, but they're not necessarily getting nutrients. And this is very well studied. So again, I think taking a step back, the health department is not responsible for providing healthy food to every resident in Kane County. However, we do see, and obesity is typically one of the issues that comes up usually through the guise of chronic disease in our community health assessments. And we have something called Making Kane County Fit for Kids, where we work, and that's Kane County Health Department started this initiative. We launched it as its own 501c3. That organization now provides grant funding to schools and community organizations to increase access to healthy, nutritious food. And I think that's the key point, is it's not just access to calories. It's not just, can you get a Big Mac or a bag of Doritos? Even kids without means can get access to those cheap foods that don't offer any nutrition because they're cheap. What we want to do, and we've done excellent things over the years here, I think in partnership with other county departments, where we've really increased access to healthy foods, more fresh fruits and vegetables, getting more salad bars in our schools, getting more access at our farmers markets so that people can enjoy the local things that we have here. But I think it's a combination, at least what I'm hearing with what Mr. Gripe said and what you said, Mr. Young, that it's not a case where this is our job to go and make sure people have these things, but it is something that we are seeing the negative impacts of, which can be reflected both in obesity and families families coming forward and self-identifying that they don't have enough food. And we can see for our food pantries across the county over the last couple of years, the size of the lines at our food pantries when they are giving away food has gotten bigger and bigger. And that's not a simple self-identification thing. People aren't choosing to go sit in line so that they can get free food just because they want it. These are people who are trying to feed their families. So unfortunately, this does continue to be a bigger problem.
And this is not a case of food that they prefer, is
Correct.
any kind of food
Correct.
for nourishment.
Correct. But I still think Mr. Young raised some good points that, and we can provide that additional information about, we shared one slide about the voting on the selections, but we can share all the data on what people said. We can break it down a little more geographically as much as possible to show in Northern Kane versus Southern Kane, et cetera.
And Mr. Young, did you have another question?
Thank you. Yes, David Young. So how many people did say, just roughly, was it 10,000, 20,000, 30,000, 100? How many people were complaining of this food insecurity?
I'll look. I mean, it's not one data point. So it's not a question of just that people said that on a survey. This came out in focus groups. This came out in talking to providers to say, when you work with families, what are the things that families are identifying as barriers? So I can put together a summary for you, Mr. Young, and provide that. So there's more information, but it's not as simple as one answer to say 80% of people said this. I mean, we'll have that for some questions, but it's more complex than that.
Maybe we could go back to I'm sorry, David, go ahead. I didn't mean to interrupt.
Oh, thank you. No, it's hard when I'm remote. No, but so it could just be a couple hundred people that are saying this. We don't know. You're not talking about 20% of Kane County is which is 100,000 people saying that we have this food insecurity. I would argue that it's maybe a 1,000 people, right?
Yeah, no, I would disagree with that. And we can't provide the specific information. This is something over the years that has become a much worse problem.
Well, but that's based upon the focus groups, and the focus groups are only a couple of people, right? So you have a couple of focus groups that talk to a couple of people, and then you go to the focus groups. Well, then, it's still just a couple of people.
Sure.
See what I mean?
Yeah, no, our process, I'll just give a 20-second overview. So the process is we do interviews where we do about 2,000 interviews, 2,300 interviews, which is statistically significant for Kane County. We do this across Kane County. It matches our race and ethnicity. It matches geographically where people are in the community. So this is a representative, generalizable survey. That's one data point. Then we also do the focus groups, which provides us, and certainly these are people who have self-identified into focus groups that we were able to recruit to participate in the conversations. We also then are working with all of our food pantries and all of our social service providers and our medical providers, and we're querying them. So it is a combination of a tremendous amount of information and input. And I can tell you with all the things that are going on in the community that are threats to our health, food access did not raise to the top because it was a small number of people. This raised to the top because the organizations that we work with are reporting that this is the biggest, one of the top 4 issues that they're seeing.
Thank you. I'd also like to say, can we go back to the slide that shows the providers? Or the
Yes.
people that we access for this information. This might be help. This wasn't a survey that was just done by the King County Public Health Department. This is a community health assessment. Can we go back to that one slide, Blair? What is that?
I think this is the page, the different community partners that we engaged.
Yes, if you look on here, is this the one? Yeah, you can see right here, just one line says healthcare providers and hospitals. We had 11 hospitals that were part of this survey. So this is a broad category. This is not just our health department. This is a community health for King County. So-
Madam Chair.
Yes, Ms. Bates?
Can I interrupt?
Oh, go ahead.
On page 73 of the packet, under food access, it says that food insecurity is 10.2% of the residents in King County as of 2022. And that was 3 years ago. I imagine it's worse than now. So 10% of 515 residents would be about 50,000 people, which is way too many for the richest country in the world.
Yes, Ms. Zuby.
I was just going to add that the Northern Illinois Food Bank served 78 million meals. Last year, they do serve 13 counties, but they give us a report every agriculture meeting, and they give us the status of their food supplies, their grant money, and we probably are not serving as many people as we should be serving. So I would argue that it's as one of the barriers is you're embarrassed that you can't eat. And so you don't go. And you rely on school lunches for your families, or you rely on other things. But if you're truly interested in hearing about homelessness, tomorrow at 10:30, we will have Hester Berry here from the Northern Illinois Food Bank, who will give yet another gut-wrenching update on food insecurity in King County.
Again, this is all about education and letting people know. Mr. Roth, you had a comment?
Yeah.
A question?
Roth here. No, it's another comment. I'm going to bring up workforce again. I got a tour down in Batavia 2 weeks ago, and they weren't aware of like the IRIS program. So I got them to the website, and they get a lot of people who are looking for jobs. Well, a lot of those people are facing stress, mental health, et cetera. So they're going to now hand that out. So I think we need to reach out. You know, we have a new director running that now because it's another opportunity to broadcast our services without paying a lot of money, because they have their own audience, they have their own staff, and there may be other departments across the county. I think because it's all about getting the news out, because 9 out of 10 do not know about IRIS when I talk to them.
Are you speaking of business and career services?
It's down in Batavia.
Yeah, they are part of IRIS. Maybe the new people don't know. So
Well, and that was the front desk, but they're the ones that are doing the handouts. So it's just, you got to just keep checking,
So I think we're ready to take a vote, and we can see the importance of this community health assessment and how it affects our collaboration, our education, and our purpose for the public health department. So
We need to do a motion first.
yes, we do need to do a motion in a second.
Thought we already did a motion.
No.
We did the motion before we talked.
No, we never did.
The one now.
Tarver makes a motion.
Who was that? Tarver, was that you?
Yes.
Yes, ma'am.
Okay, and a second?
Hennessy second.
Ennis is second. Okay, thank you. Thank you. Okay, so please take the vote.
Arroyo,
Yes.
Juby,
Juby, aye.
Genesis,
Hennessy, yes.
Carver,
Tarver, yes.
Young,
No.
Sanchez, Roth,
Roth, yes.
Strathman.
Yes, passes. Okay. That was a lot of really, really good information. A lot of really good information today. Thank you so much. Do we have any old business? Oh, okay. I'd like to ask for a unanimous consent to place the reports on file.
Yeah. Roth would request we do a unanimous consent. to replace the reports.
Yeah.
No.
Any objections?
It's a big word, longer than Roth.
Okay, I don't think we need an executive session. Mr. Greig, you have a comment or?
Just a quick comment. And it's a compliment to you, Madam Chair, for this committee. When I first joined the board, I'll make this quick. You know, committees seem to be people coming in, my reports are on file, next, vote, adjourn, right? And I said, "Well, that's silly, because nothing really gets discussed, nothing gets done. The presentations are made. At this meeting today, I think we've come the closest to what I think is the new model, should be the new model for every committee from the county board, where there's presentations, succinct presentations, good discussions, questions, comments, pro, con, and then still vote on stuff. But this is getting towards what I think committees should really do. So I'm complimenting you and this committee, which I'm not a voting member of, but I think this is the template we should use.
Thank you. Thank you very much. And it has always been my desire, when I became chair and I learned about all that the public health department does, and I thought, if I don't know this, other people don't know this either. And it's such a fact, there's a reason that they are voted #1 healthcare provider to work for, right? So it's such a fabulous program, and I am happy to do my part to educate and collaborate and let people know, because I think we are really lucky and blessed to have this department. So thank you all. Mr. Roth.
I just want to add one thing, and we're going to get done before 10:30. So thank you.
Well, I would like to say that time is not always a qualifier for
No,
a good.
that's
meeting.
right.
So, so I need a motion.
May I
Ms.
ask-
Bates.
New business, could we talk about the measles outbreak someday?
Thank you.
Yeah, we can bring more information about measles next month, just in brief, as people are seeing. And I think I've mentioned this in past months, that this does continue to be a concern. Nationally, we have had another death attributed to measles. This is something that, as I mentioned, measles was eradicated in the United States over 20 years ago. So this is completely preventable, that it is returning. We do have a new dashboard that maybe we can share next month when we come. We do have pretty good immunization rates at our public schools in Kane County, so that's good. But there continues to be more concern from people and resistance to getting vaccinated, and that's dangerous. We know the outcome of that. We're seeing it across the country right now, unfortunately.
And do adults need shots?
Okay. Okay, so
Thank you, Madam Chair.
thank you. I need a motion to adjourn.
Roth will make the motion to adjourn.
Okay.
I was trying to get you to
All in favor?
make the motion.
Oh, were you seconding? You were seconding. All right. All in favor?
I just think that
Motion is,
Aye.
our meeting is adjourned until May 21st.